Hey everybody, this is Dr. Paul Thomas with Plum Health DPC here in Detroit, Michigan. I was a TEDx speaker in 2017 and it changed my life. Your organization, your audience is tremendous. I love you guys for being a part of this movement called TEDxDetroit and for supporting me in my journey. I talked about how I believe that healthcare should be affordable and accessible for everyone. I still believe that and I'm working towards that every day. We meet our patients where they're at. We welcome the newest members of our community in our clinic. We take care of lacerations by sewing them up for people. We deliver medications to people in our community. We make house calls, and we're building a great team to serve people and to make healthcare affordable and accessible. We do this in our community here in Corktown, and we recently opened a larger office here to serve more of our community. So I just want to say thank you for helping me in my journey. But while I have your time and attention, I want to talk about something that's really bothering me. The cost of healthcare in America continues to grow at an insane rate. And I just want to highlight one example of how this happens and show you how it's creating so much havoc in our economy, for our employers, and for us as citizens. So a woman in New York went to have a throat swab for what she thought was a cold or maybe a bacterial infection, a viral or a bacterial infection, and she was charged $25,000 for the service. Now, let me back up and say, usually a physician can do a thorough examination, talk to their patient, develop a trusting relationship, and find out that it's either a virus or a bacteria and treat appropriately. A throat swab isn't a typical practice. We don't typically use throat swabs for our patients with colds or maybe strep throat. We either just treat it, move on, and we don't really use a throat culture. This is pre-coronavirus, mind you. So this is what was all included in this patient's testing. This was in October 2019. She was tested for adenovirus, some coronaviruses, influenza, parainfluenza, respiratory syncytial virus, just a lot. This is way too much of a workup for what this woman came in with. And it ended up costing her $25,000 because it was an out-of-network lab and an out-of-network service that was being provided. What's even more shocking is that her health insurer paid for this. The health insurance company stood up to this $28,000 charge and paid $25,000 of it. And so this patient was left to owe the doctor $2,500, which is also crazy. But aren't the health insurance companies supposed to be looking for price gouging in our healthcare system? Aren't they supposed to be putting an end to this? Because if their costs rise, the more they have to pay out, and the lower, the less amount of money they keep for themselves, so the less profits they have. So you would think that they'd be looking out for us as consumers and trying to cap these costs. However, that's just not how it works out. Healthcare spending, because of the Affordable Care Act, has an 80-20 rule, meaning that 80% of spending has to be spent on healthcare costs and quality improvement activities. So for every $100 that you put in the system in your premiums, $80 has to go to healthcare costs. Now, 20% can go to administrative overhead, marketing. So administration, overhead, and marketing. So that can include profit. So what's been happening since 2009 is that in order to grow profit margins for health insurance companies, they've decided, let's just make the pie bigger. Let's not try to tamp down costs and be more efficient. Let's just increase the size of the pie. And that's what they've done. So now, instead of spending $2.5 trillion in 2009 on healthcare in our country, we're now spending $4 trillion. And that's an insane increase. Again, because those profits are coming out of that 20%, that administrative overhead and marketing costs. That's where that profit margin comes in. So what happens to us? What happens to the American family when we're hit with these huge and increasing costs? So it used to be that this is for a family, and this is the employer side and the employee side payment for health insurance coverage. So the employer would kick in about $10,000 in 2009, and the employee would pay about $3,500 annually for health insurance. And now the employer has to kick in $14,000 and the employee has to kick in $6,000 each year for health insurance. Those are tremendous increases, and that really translates to more and more of our health care, of our dollars, our income being spent on health insurance. So this is the average family premium as a percentage of family income. It just keeps increasing over time. And it also translates for businesses. They can't really give more money to their employees in terms of salary, but they're just hanging on by paying more and more in health insurance costs. So it really becomes this difficult thing for both employees and employers. And as a small business owner, this is a challenge that I face acutely, is trying to find a good health insurance plan for our company. Ironically, right? I'm a doctor, and it's difficult because it's just so expensive. Now, throw into the mix the coronavirus pandemic. So we lost 22 million jobs during the coronavirus pandemic, and so far we've only regained about 42% of those. This is as of August 7th. So what's really crazy here is that when you tie your health insurance benefits to your employer, when you lose your job, you also lose your health insurance benefits. Now, I don't know what all the answers are going to be, but I know that we definitely need to remove the middlemen and the profit takers who are taking a lot of money out of the system, and return the system to be more or less between doctors and their patients, and using health insurance more appropriately. Rather than health insurance paying for a throat swab that you don't need, health insurance should really cover hospitalizations, cancer care, accidents, and emergencies. Again, I don't have all the answers. We really need to brainstorm ways that we can lower the cost of care while providing better insurance coverage for more people in our country. Thank you so much for taking your time to listen to me and my ideas about healthcare and how it should be. And I'm going to go back to taking care of my patients for the day. Thanks again, and have a wonderful day.